Welcome to the London Northwest Critical Care team, and welcome to our training video on MRI transfers for ICU patients. We created this training program to ensure the safety of patients and staff during GA MRI scans. We recognize you may have probably done many intra-hospital patient transfers by this stage and have a good understanding of this process. In this training, we will be highlighting some of the specifics related to MRI transfers within our trust. We will briefly discuss how MRI works, share some MRI-specific safety reminders, and show you the process of doing a GA MRI scan for an ICU patient. MRI is a commonly used imaging modality used to create detailed images of soft tissues. MRI scanners work by a technology called nuclear magnetic resonance, which incorporates a strong magnetic field gradients, and radiofrequency pulses to generate images through interacting with the body's hydrogen atoms. A final MRI image is a composite of detectable radiofrequency signals from the different hydrogen densities of different tissues. This concludes our brief introduction of MRI physics. If you would like to read more about the science behind MRI scans, please follow the QR code. We will now move on to discuss basic MRI safety and equipment that you may encounter in the MRI suite. In general, MRI is safe, and most injuries that can occur are usually the result of failed safety procedures or human error. If you're in doubt at any point, please ask your MRI radiographer. Preparation and knowing your patient's history are key. Here's a video demonstrating just how powerful and dangerous MRI scanners are. As part of your first MRI transfer, you will have to complete an MRI safety checklist for yourself to ensure that you have prepared yourself and it's safe for you to enter the MRI suite. This will be kept within the MRI department and you will be marked compliant by the team. Please do update this checklist if your medical condition changes. Occasionally, the MRI team may ask you to update your details or recomplete this form. Please comply. Your patient should also have an MRI safety checklist completed ahead of time and checked by the MRI team prior to the transfer. Any magnetic material is at risk of moving at a very fast speed with the potential for fatal accidents. You must remove any metal from your own body and your patient's body ahead of time, including jewelry, needles from syringes, mobile phones, lanyards with ID badges, and pens. Please do not bring any medical equipment into the MRI suite that is not MRI compatible. This includes the cardiac arrest trolley. If you're not sure, or if you have any questions, please ask your MRI radiographer. The reason the patient's MRI checklist should be completed before the day of their scan is to allow the MRI team enough time to review any medical implants or devices the patients may have and avoid cancellations and delays. Please pay close attention to pacemakers. Most old-generation pacemakers are not MRI safe, while new generation ones are MRI conditional. This requires a cardiac physiologist to program the pacemakers into a safe mode before the patient enters the room. Other critical devices that are not MRI safe include cochlear implants, some aneurysm clips, neurostimulators, and infusion pumps. Patients with any of these implants must be checked by the radiographers before proceeding with the general anesthesia in the MRI suite. More information on specific implants can be found in the MRI safety documents provided by the implant manufacturers, and additional details related to MRI safety can also be accessed at mrisafety.com. The MRI scanner produces a loud noise, and it is your responsibility to ensure your patient has hearing protection on to avoid permanent damage. Just like for CT contrast, there is always a risk of an allergic reaction to contrast administered to your patient during their scan. It is helpful to know whether your patient will be receiving IV contrast or not. This now concludes our overview of safety precautions to be aware of within the MRI department. Next, we will talk you through the process of a GA MRI scan, from preparing the MRI suite, the equipment you'll be using, preparing your patient, and the scan itself. Let us show you the preparations conducted in the MRI department before all GA scans. The patient MRI safety checklist is the initial step. Staff members meticulously review and verify all safety measures before the patient's arrival. This must be signed by the patient themselves or a relative who knows their medical history. Switching on, testing, and equipping both the LNWH and Fabius MRI anaesthetic machines are crucial steps usually carried out by the ODP. It is best to perform the machine check in the anaesthetic room in advance of arrival of the patient. The main power button is located at the back of the anaesthetic machine. After checking the gas lines are securely connected to supplies, perform a routine test, including checking the oxygen sensor as per the machine manufacturer. Familiarize yourself of the machine operation in advance of the first scan you do. Once tests are complete, the ODP will position the MRI safe anaesthetic machine in the MRI suite and reconnect the main gas supplies and power. Familiarize yourself with the side stream carbon dioxide monitoring and fiber optic connections to the master monitor. As always, make sure there's a water circuit available in case of any equipment failure. This is the Fabius anaesthetic machine. This may vary at different sites or over time. Please take time to familiarize yourself with the ventilator prior to bringing the patient down. You will require a long circuit for the scan, 4 meters ventilator and capnography tubing. This is a Tesla M3 Bluetooth monitoring system. It consists of a master monitor inside of the MRI suite and a slave device inside the control room. It can suffer interference from the radio frequency signals in the MRI scanner, so remain cognizant. There is also the bronze space station for the infusion pumps, which will be inside the MRI suite with the patient. You will be able to see the monitoring screen from the control room. In the event of physiological instability, you may need to give a bolus of an emergency drug, such as metronidazole. Ensure that you disconnect any drawing up needles from a syringe before you enter the MRI scanning room, as these may act as projectiles. If your patient has a medical emergency whilst in the scanner, it is safest to take them out of the MRI scanning room and transfer them to the designated safe zone, where you will have access to the cardiac arrest trolley and other non-MRI compatible equipment as required. This is a designated safe zone outside of the scanning room, ready for immediate patient transfer in case of any medical emergencies. The MRI radiographers are trained and able to assist with the immediate transfer of patients outside of the scanning room in case of an emergency. Do not, under any circumstance, bring the cardiac arrest trolley into the scanning room. If this rare situation does happen, the radiographer will disengage the MRI trolley, and you should disconnect the ventilator at the entrance of the scanning room and then ventilate with a water circuit. The MRI staff can lower the trolley to permit for CPR. In summary, preparation and strict adherence to safety protocols are pivotal for a successful and safe patient transfer to the MRI suite. Next will be a brief introduction of the specific equipment you will be using when you're in the MRI suite. This is the MRI compatible monitoring available you must switch your patient onto upon their arrival to the MRI department. Cardiac leads, saturation probe, blood pressure cuff, and arterial line transducers. This is the MRI infusion pump, the bronze space station. This is safe to go into the MRI suite. It will fit up to 4 of our standard Baxter pumps and has hooks to hang any infusion bags as needed. It has a locking mechanism as shown. You must ensure all pumps are safely locked in place and the door is shut before entering the scanning room to avoid any interference. These are the anaesthetic machines in use in the MRI suite. Ensure you and your ODP are familiar with the different controls, as it may differ from the ones you use in theatres. We must now transfer the patient from their hospital bed to the MRI compatible patient trolley. The brakes are located as shown and the side rails operate as follows. This concludes our overview of the equipment in use in the MRI suite. I will now hand over to my colleague who will discuss how to prepare your patient for the MRI transfer.
Now you have seen what the MRI scanning room looks like and have an idea of the equipment you'll be using. We'll discuss how to prepare your patient for the transfer. Before the transfer, ensure you complete an A to E assessment of your patient and review their admission documentation. Make sure you know what the MRI is for and the MRI safety checklist has been completed for the patient and received by the MRI team. This should be completed with as much anticipation to the scheduled scan date as possible. Additionally, a standard intra-hospital transfer checklist is completed before the transfer. Please ensure all staff members accompanying the patient to MRI scanning room bring only essential personal items and remove all jewelry prior to the scan. A comprehensive briefing session takes place among the ICU team members. Roles, responsibilities, and the transfer plan are discussed. Ensure all essential infusions are connected to 4-meter long infusion lines. Any non-essential infusions should be discontinued and any renal replacements stopped within an appropriate time frame prior to the allocated scan time. Give yourself a full hour. As with all transfers, ensure your essential equipment is available and working. For instance, oxygen cylinders and portable ventilator. You will often have a porter accompanying you on your transfer to the MRI. Ensure they are aware of the scheduled scan time. A final team huddle is helpful to communicate any last-minute instructions, ensuring a coordinated and safe transfer. In summary, preparation is key. Preparing your patient for an MRI scan can take some time as this is a slightly more complex transfer than a routine CT transfer. We will now move on to our final section and talk about the process of the scan itself. Once you have arrived to the MRI department's anaesthetic room, you will transfer your patient to the MRI compatible monitoring, ventilator, and trolley. This is how you insert your patient's infusion pumps into the bronze space station. Make sure it is locked prior to entering the MRI scanning room. Our patient, now stable on the MR transfer trolley, undergoes a meticulous safety check by the MRI team, ensuring compliance with MRI safety protocols. In order to transfer your ventilated patients from the transport ventilator to the anesthetic machine, bring the patient to just outside the doorway of the MRI scanning room. Disconnect here and transfer to the MRI safe ventilator. We suggest you do this transfer just outside the door to the MRI scanning room, as the Fabius ventilator should have the extra long tubing already attached. You can pause at this stage to ensure you have a good capnography trace on your Tesla monitoring screen inside the control room prior to entering the MRI suite. Do not bring the portable monitoring block into the MRI scanning room. Before you go into the MRI scanning room, do a final sweep of your patient, ensure they are comfortable and stable, check their bed space for any equipment accidentally left behind, and check yourself before you go in. As the patient is transferred into the MRI room and table, you must make sure that no routine anesthesia equipment or needles enter the MRI exam room without the approval of the MRI radiographer. This is a good time for a test run to ensure all cables and lines have enough slack. Inside the control room, you can confirm the monitors are working. Be aware that because this monitor works through Bluetooth technology, they often have brief periods of loss of signal for certain parameters. Once all the systems are validated, the MRI scan may commence. The scan itself may take over an hour. Your radiographers will update you on their progress as able. Finally, extract the patient in the reverse order that you came in. Now is not the time to rush. Check yourself for metal containing items. bring the patient close to the doorway of the MRI suite, detach from the MRI ventilator tubing, reattach to the transport ventilator, change all monitoring back to the transfer block. These scenes highlight the meticulous final checks and verifications conducted before initiating the MRI scan, emphasizing the coordination between staff and the control room for a smooth procedure. Thank you for watching our training video. We hope you now feel more prepared to carry out MRI transfers for our ICU patients. We hope you enjoy your time with us at London Northwest. Welcome to the team.